Hello, everyone, and welcome to another installment of our Ask an Expert with TGH, part of our live Q&A series, where you have an opportunity to spend some time and learn from some of our world-class experts here at Tampa General Hospital. My name is Phil Buck. I'm a public relations specialist here, but we are very excited to be joined today by Dr. Rajendra Baliga, who is the medical director of the TGH Pancreas Transplant Program, as well as Dr. James Huang, abdominal transplant surgeon and surgical director of the Living Kidney Donor Program from Tampa General Medical Group. Doctors, thanks very much for your time today.
Thanks for having us. It's a pleasure to be here.
We're excited for this conversation. It is April, which is Donate Life Month. This was created to help bring awareness to Americans to register as organ, eye, or tissue donors, and then honor those as well who have saved lives through donation. And over the next 20 minutes or so, we're going to touch on all things related to transplant and organ donation with these experts. Now, of course, this is a live Q&A session, so we invite you to go ahead and add your questions in the comment section of this Facebook stream. And given the time allowed, we're going to try and get as many of those to our experts as possible and get those answered for you. That said, please try to keep your answers pretty general in nature and not too specific. I mean, obviously, we're speaking with our experts here today, and we're going to be getting some great information. But anytime you're looking for individualized medical advice, it is very important that you talk to your primary care provider in any of those circumstances. So we don't want to have this substitute what would be a consultation with your primary medical provider. This is general information, but also really helpful stuff. And we have some of the best in the business here to help us talk about some of these really complex and important topics. Quick factoids for you. Tampa General Hospital is the 6th busiest transplant center in the country, the 3rd busiest for kidney transplants, and the 10th for liver transplants. And we perform a record-breaking amount of life-saving organ transplants every year. These doctors right here are a major reason for a lot of that success. So let's start, I think, with Dr. Baliga. Can you tell me what type of volume what does type of volume mean for anybody who's coming in for a transplant care here at TGH? That type of volume phrase, what do people need to know?
So Phil, thanks for that question. It's actually that's a really important question that you asked, because it's not just important to be in a transplant program which does it well. These volumes do matter. By that I mean, when you go to a transplant program with the volumes that Tampa General has, which is number 3 in the country, we did more than 1 kidney a day on an average the last year, and keeping up with the same pace. What that means, these volumes matter. And what has been shown over and over for many different diseases and states, but specifically for kidney transplantation too, is larger volume centers tend to do much better than smaller volume centers. So it does matter in the scheme of things where you get transplanted.
I think that makes a lot of sense. Larger volume means more experience,
Absolutely.
Dr. Huang, when would somebody become a candidate for an organ transplant? And if you can, maybe walk some of our audience through what that transplant process is like.
So unfortunately, people, when they get sicker with liver failure, heart failure, or kidney failure, their main doctors are nephrologists, cardiologists, hepatologists, will refer them to our center if they think an organ transplant is needed. So for one of the processes to be referred to our center, and hopefully our reputation has reached the referring doctors to know that we have a world-class center here, that patients don't have to leave Florida or leave Tampa to seek the best care possible. Now, once they get referred for evaluation, then we determine whether there's other ways we can modulate the disease, or indeed if transplant is necessary. Then they will go through a series of evaluations and to look at their suitability. Not everybody is suitable for transplant, and we have to sort that out. That transplant indeed will help them get better And if that's the case, then they get on the list. Now, once they get on the list, then it's a matter of finding the organs for them. It's not always easy, and that's why there's a waiting list. There's people that don't do well on the list, but every organ has a different waiting time. For the kidneys, we're looking at 3 to 5 years for a deceased donor. But fortunately for kidneys, we can kind of accelerate that by having a living donor. And if we can have living donors for kidney transplants, then these recipients will receive that life-saving gift much quicker, much earlier, start feeling better, and start getting back to their normal way of life. That's the advantage that we can provide here in our program.
And Phil, if I may add to what Dr. Wong just said, it's really important to note that different organ systems and wait lists have their own ways of. Each organ is different in that sense. And on the kidney side specifically, the wait times do matter. And with more and more patients waiting on the list, these wait times have gone up significantly over the past few years. And that's the reason why, like Dr. Wong just mentioned, getting a living donor organ, which works right away and tend to last longer and work better, is the preferred way to go for organ transplantation from the kidney side.
Excellent. That's thank you for adding that. I appreciate that because that's helpful. And actually, we are starting to get some questions in from some of the audience. Some of these are really good questions already rolling in, and I think one of them is sort of related to what you both are talking about right now. So I want to get to this. Heather's asking, what's the earliest that someone can be evaluated for a kidney transplant?
So I can take that one, Phil. So there's a common misconception that you have to be on dialysis to get a kidney transplant, and that's not true. So patients can be evaluated for transplant once their kidney function is sufficiently bad. When we do any organ transplant, or whether it's kidney transplant or other, we have to weigh the risk versus benefit of the procedure. And for most patients on dialysis, transplant is the right way to go. But once the kidney failure is advanced, even before they're on dialysis, we can certainly evaluate the patient. Typically, the kidney function has to fall below about 20% or so, at which point we can evaluate these patients for transplant and hopefully get them transplanted even prior to them actually ending up on dialysis. And that's really important because there's clear data over the past many years that the earlier you get a transplant, the better patients do. And patients who get transplanted without ever going on dialysis tend to sort of do the best.
Excellent. Appreciate you taking that. And hopefully, Heather, that answers your question. And I do want to remind everybody, keep the questions coming because we are getting some good ones in the chat. But I want to get back to Dr. Huang really quick. Can you tell me why organ donors are needed? And what are the instances of a living organ donation? A few years ago, we heard, I think, in the media about Selena Gomez receiving a kidney transplant from her best friend. So maybe you can go into a little bit more detail about how a living donation works.
Yeah, those are great questions. In a transplant program, without organs, we can't do anything. And the success of our program really has been due to the generosity of donor families who, in a time of possibly tragic outcome, that have allowed their loved ones to become organ donors. Without organs, we're not any different from any other hospital. So the generosity of organ families, generosity of living donors that come through provide us the opportunity to do the types of life-saving operations that we do here day after day. Now, in regards to living donation, I think the main thing for that is that people want to do living donation, but they may be afraid of what may happen with the surgery. They might worry about what may happen with time off from work or how long the recovery. In regards to sort of Selena Gomez, she had a friend who donated. And we see that there are so many people that have friends and family that help them out. We have all sorts of combinations of living donor for kidney transplants, not only within families, but we've had stories for friends find each other on Facebook and find out that one of their friends from high school now needs a kidney transplant, and they selflessly do and donate. There are people who recently altruistically with someone who they don't even know, have any relationship with, maybe seeing something on a billboard or a T-shirt or something like that, have come forward to donate. And we want to let people know that it's a very safe process to donate your kidney. The surgery is very minimally invasive. It's only a 1 or 2 day recovery in the hospital. And some of the donors are able to go back to work in 2 or 3 weeks, depending on the type of work they do. And as much as we want to help recipients get their transplants, we have a responsibility not to hurt the donors who are donating as well. So they'll go through a very thorough evaluation to look at their health and look at their suitability, look at the way they care. And we find that a lot of donors get healthier to donate, lose weight, quit smoking, quit some bad habits. And one of the good side effects we see from living donation is that afterwards, a lot of the donors take even better care of themselves, knowing that they have one kidney. They watch their blood pressure. They don't pick up smoking again. They keep their weight down. So sometimes it's a win-win situation for both the recipient to get a life-saving organ and for the donor to become a healthier person overall. So I think that's the message that we want to convey to the population here, so that they consider this as an option for someone they care about.
That's really fascinating, and that's nice. I think that's a nice angle. You think about so often the recipient in a transplant situation, but it's nice to hear that the donor often, is reaping benefits of the health benefits of their own. So listen, I want to say thank you to our audience. You guys are really coming through with some great questions. And doctors, you can't see the comments, but I'll tell you, you have a lot of fans as well who are just giving you shouts out and saying thank you and calling you guys rock stars and everything. But I want to get to as many of these questions as possible in the next few minutes. So maybe if we can just sort of do a rapid fire. I'll start with a question from Shelley, Dr. Baliga. What determines who's a good candidate for a kidney transplant, and also who's not a good candidate?
Right, and that's a complicated question for a rapid fire question, quite frankly, Phil, because each candidate has, all of us have our own, medical issues and things like that. So like Dr. Wong mentioned earlier, we have a whole team from the surgeon to the nephrologist, social worker, financial analyst, everyone doing a holistic assessment of each patient to make a decision about their candidacy. And for most patients, transplant is the route to go to treat their kidney failure. It's not a cure for kidney disease, but it's definitely much better than dialysis for most patients. However, it is not necessarily for all patients, and that really depends on individual to individual. If we think that they have medical issues in which the risks of the procedure and the post-transplant medications outweigh possible benefits, those patients are possibly not candidates for transplantation, and they're better off continuing with the dialysis or other supportive therapies they're on. But that's really a small portion. We try and transplant as many patients as we safely can, because we do realize that even if someone is so-called considered high risk, if we can safely get them through the procedure, long-term, they tend to do very well. And this is where the high volume center does play a big role in that.
Excellent. Excellent answer. You did a great job doing that rapid fire there. That's a lot of information in a little amount of time. Here's another good question, and I'll leave it up to both of you to who wants to answer this. Devin is asking how the COVID-19 vaccine is working out for transplanted people.
If you don't mind, James, Dr. Wong, I'll take that one. There's a lot of these. This is the most common question that we have encountered in the past few months, and it's all related to the risk and benefit ratio. And here's what I tell my patients when they ask me this question. Is it safe? From all the data that we have, these vaccines are safe to be taken. What we also know that COVID has been not kind to in general, but especially unkind to transplant patients, and there's been significant morbidity and mortality. Now, just like with most vaccines, we expect transplant patients not to respond as well to the COVID vaccine by forming immunity. But the way we look at it at this point is that some protection is better than none. And even if the vaccines prevent hospitalizations or patients from getting really sick, that's a plus rather than someone dying from COVID. And I think we have seen some effect, anecdotally, even at this time, where patients who've received vaccination don't seem to get as sick, even though they may get COVID. And that's the whole point of vaccination in general. Not necessarily to prevent COVID 100%, which is probably not possible in transplant patients. But even if the severity is less and we have less morbidity and mortality, that's a win. So I strongly encourage all our patients to get whichever vaccine is available for them at this time.
Excellent. Thank you for that. And it sounds like you're getting a lot of the questions as well. So I have a feeling other people in the audience probably were interested to hear that as well. We do have a couple more minutes, and I want to get to as many of these questions as possible. Here's what appears to be a yes or no question. Dr. Huang, maybe you want to take this one. Does TGH perform pediatric transplants?
Yes.
There we go. That's a quick one.
We have pediatric transplants in children with kidney failure. So as young as 2 years old, I think that's what I recall. And also we would consider pediatric anywhere from age 2 to 19, thereabouts. So we have adolescents that are being transplanted. We have younger children that are being transplanted. And we'd probably do about 15 to 18 sort of pediatric kidney transplants a year.
And we have a good relationship with the pediatric nephrology team. So pediatric patients who are transplanted can sort of transition onto the adult side if and when that happens.
Wow, that's great. That continuity of care, is so important, I think, post-transplant. So it's great that you guys have that relationship. Forgive me if you already answered this, but Frank is asking, what is the expectation? So what's the expected life of a current deceased donor kidney after 5 years? I don't know if that makes it. Maybe I'm not reading that correctly. A current deceased donor kidney after 5 years. What's the expected life?
So I understand what Frank is trying to get at. And, one thing we know is that these kidneys don't last forever, although we hope to and we try our best to make sure that happens, but things sometimes happen along the way. Sometimes there's surgical problems, sometimes there are infectious problems, sometimes there are medical issues, rejection, things like that. So on an average, a deceased donor kidney transplant that Frank is referring to lasts on an average about 10 to 12 years or so. What that means is that 12 years on, after a transplant, about 50% of these kidneys are still functioning. With a living donor transplant, it's about 15 years or so, which means that at 15 years after transplant, about half the grafts that we put in are still functioning. So that's also brings us to the importance of, not just early transplant, but also preferably living donor transplant, because they do tend to last longer.
Excellent answer. And I think that's probably a good place for us to stop, just in the interest of being respectful of your time, both of doctors. But I do want to say a huge thank you to you. And thanks to our audience. These were really great questions. And I think we've had a great conversation here today. I'll tell you, Dr. Huang, one of your former patients is in the comment section as well. She's celebrating 8 years in May after her transplant. So congrats there. And I think that if you guys go back, you'll see a lot of love for you and for the TGH transplant program in the comment section. With that, I think we're going to let Dr. Baliga and Dr. Huang get to the rest of their busy days, but I want to thank everyone for being a part of this conversation. Of course, to explore information on the transplant process, go ahead and visit www.tgh.org/transplant-process. 100,000 people plus in our country right now are awaiting transplantation and depend on those who have decided to give that gift of donation. We just heard how important that living donor process part is to the process. It's critical to these patients and really has a lot of benefits down the line. If you want to sign up to become an organ donor, and of course we encourage that, go to www.donatelifeflorida.org or www.registerme.org. And of course, you can see both of those sites on the bottom banner of the screen. One more big thank you to Drs. Baliga and Huang. I really enjoyed this conversation. Thanks very much for your time today. To everyone else, thanks for joining us. This has concluded another live Q&A here with our Ask the Expert series here with Tampa General Hospital. Forgive me, I forgot the name of the series for a minute.
Thank you, Phil.
Thanks, everybody. It's been great. Thanks, docs. You guys have a great rest of your day.
All right, anytime.
Thank you.